PM Cares Fund constituted to strengthen fight against coronavirus. Prime Minister Modi appeals to people to donate to the fund, says it will strengthen disaster management capacities and encourage research on protecting citizens. Prime Minister interacts with AYUSH practitioners. PM Modi says AYUSH sector has a long tradition of keeping the nation healthy and has an important role to play in checking the spread of COVID-19. Stresses that it is important to counter and fact-check unsubstantiated claims of AYUSH having cure for the disease. The main thrust of the Ministry of Health to deal with coronavirus is on creation of specialized hospitals for COVID-19. In a press briefing, Ministry says it is working with states for community monitoring and rigorous contact tracing. Total number of confirmed cases in India rises to 918. 19 succumbed to the disease. Important announcement for migrant workers. Home Ministry says state government can provide shelter and food to those in need with support from State Disaster Response Fund. Delhi's Chief Minister Arvind Kejriwal appeals to migrant workers to not leave Delhi, says Delhi government is providing free meals and shelter to those in need. Finance Minister Nirmala Sitharaman interacts with CMDs of all public sector banks. FM asks them to ensure uninterrupted banking services across the country while maintaining social distancing norms. And international coronavirus cases continue to spiral up with more than 5.5 lakh cases, killing nearly 25,000 people. In Italy, deaths rise by 919, highest daily tally since start of outbreak. 345 deaths and 18,000 new cases in the last 24 hours in the United States. Good evening, I'm Shubhendu Ghosh. Now the stories in detail. With the aim to provide further impetus to meet the challenge of COVID-19 outbreak, Prime Minister Narendra Modi has set up PM Cares Fund in which citizens can make donations. Prime Minister Modi shared this information on Twitter. He tweeted and said, "People from all walks of life expressed their desire to donate to India's war against COVID-19. Respecting that spirit, Prime Minister Citizen Assistance and Relief in Emergency Situation Fund has been constituted." Now this will go a long way in creating a healthier India. He appealed to all Indians to contribute to PM Cares Fund. This fund will also cater to similar distressing situations, he said, if they occur in the times ahead. The PM Cares Fund accepts micro donations as well as smaller donations. It will strengthen disaster management capacities and encourage research on protecting citizens. And PM said, "Let us leave no stone unturned to make India healthier and more prosperous for our future generations." And now on your screens are the details on how you can contribute to this fund. Well, the name of the account is PM Cares, account number 2121 PM 20202, IFSC code to make a transaction SBIN 0000691, and the SWIFT code is SBIN INBB104. The name of the bank and branch are State Bank of India, New Delhi, main branch, and UPI ID is PM Cares @SBI. And the following modes are available for making donations. You can use your debit cards, credit cards. You can make an internet banking transaction. UPI modes are also available. You can use the apps like Bheem, PhonePe, Amazon Pay, Google Pay, Paytm, MobiWik and others. RTGS and NEFT money transfer donations are also possible. And remember, donations to this fund will be exempted from income tax under Section 80G. And those are the details of the PM Cares Fund, the means and the ways in which you can make a donation, however big or small, to this fund that Prime Minister has started to tackle COVID-19. Moving on, Union Home Minister Amit Shah has appealed to people to contribute to PM Cares Fund. He tweeted and said, "Time and again, we Indians have set an example for the world on how to come together in adverse situations. Let us join hands in this fight against COVID-19 and contribute to PM Cares Fund launched by Prime Minister Modi. Every contribution is valuable, no contribution is small. And BJP President JP Nadda has announced that all party MPs will release rupees 1 crore from their annual development fund to the Central Relief Fund to fight coronavirus pandemic. He tweeted, all MPs and MLAs of Bharatiya Janata Party will donate their 1-month remuneration salary to Central Relief Fund to support the fight against COVID-19. All MPs of BJP will release rupees 1 crore from their MP Lads Fund to Central Relief Fund in support of the fight against COVID-19. And Lok Sabha Speaker Om Birla has also appealed to MPs across party lines to contribute rupees 1 crore from their MP Lads Fund to the Prime Minister Citizen Assistance and Relief in Emergency Situation Fund or PM Cares Fund. The donations will be used to ensure availability of screening kits, masks, personal protection kits and other medical equipment and aid needed to fight the COVID-19 pandemic. He emphasized that people's representatives should ensure that the lockdown does not impede the poor and the needy in meeting their basic needs. And actor Akshay Kumar has announced that he will contribute a sum of rupees 25 crore to Prime Minister Modi's recently announced PM Cares Fund to fight the novel coronavirus pandemic. He tweeted and said, "This is that time when all that matters is lives of our people, and we need to do anything and everything it takes. I pledge to contribute rupees 25 crores from my savings to PM Narendra Modi's PM Cares Fund. Let's save lives. Jaan hai to jahan hai," he says. An IAS association also has decided to contribute to PM Cares Fund. The association tweeted and said, IAS Association decides to contribute rupees 21 lakhs to PM Cares Fund as its initial contribution to combat COVID-19. All members to contribute at least a day's salary as well. And we shall leave no stone unturned to ensure that we win this fight against COVID-19. We shall overcome, they say. And CEO PhonePe app Samir Nigam contributes for PM Cares Fund. He tweeted and said, "Come on India, join PhonePe #100 crore pledge. We will add rupees 10 to everyone's donation to PM Cares Fund. Donate via UPI, NPCI now. And let's get 10 crore Indians to donate to this amazing cause. And we will pledge rupees 100 crore on top of that." An Indian cricketer, Suresh Raina, has also urged citizens to help each other to win the fight against coronavirus. He tweeted and said, "It's time we all do our bit to help defeat COVID-19. I'm pledging rupees 52 lakh for fight against coronavirus, 31 lakh to PM Cares Fund and 21 lakh rupees to Uttar Pradesh CM's Disaster Relief Fund. Please do your bit as well. Jai Hind, stay home, India." Total number of active cases of COVID-19 in India at present has risen to 819. 80 patients have been cured so far or have migrated, and 19 deaths have been reported so far. That's the data that is available at the moment, the latest data. And Union Home Minister Amit Shah took a high-level review meeting to take stock of the steps being taken to contain COVID-19 and to ensure minimum inconvenience to all while the 21-day lockdown period is on. In his daily briefings, spokesperson of the Health Ministry, Lav Agarwal, said that the focus at the state level is to set up exclusive COVID hospitals and enhance ICU and isolation capacities.
हमारा कंबाइंड एफर्ट यही इंश्योर करना है कि लॉकडाउन और सोशल डिस्टेंसिंग का प्रॉपर तरीके से पालन किया जाए। कोविड-19 से लड़ने के लिए गवर्नमेंट ऑफ इंडिया अभी हेल्थ इंफ्रास्ट्रक्चर प्रिपेयर्डनेस पर स्टेट के साथ काम कर रही है। हमारा मेजर फोकस है कि हम डेडिकेटेड कोविड हॉस्पिटल्स बनाएं, डेडिकेटेड कोविड ब्लॉक्स बनाएं और साथ ही आइसोलेशन बेड्स, आईसीयू बेड्स और जो रिक्वायर्ड लॉजिस्टिक्स है उसके लिए तैयार करें। मिनिस्ट्री ने कोविड के रेस्पॉन्स को स्ट्रेंथन करने के लिए स्टेट के लिए स्पेसिफिक नोडल ऑफिसर्स भी नियुक्त किए हैं।
The union government as well as state governments are taking several steps to help the migrant laborers and stem their exodus. Ministry of Home Affairs has directed states and union territories to use SDRF fund allocations to make provisions for temporary accommodation, food, clothing, medical cares, and so on for the homeless people, including migrant laborers stranded due to the lockdown. Cabinet Secretary Rajiv Gauba spoke to chief secretaries of all states to ensure that food and shelter for migrant laborers returning home is made available.
States can explore the option of setting up tented accommodation for those who are on the road और जिनको अभी वापस लाने में समय लगेगा. दूसरा, जहाँ भी रिलीफ कैंप्स है वहाँ पे मेडिकल चेकअप ड्राइव्स करवाएं जिससे कि हमें पता चल सके कि हाउ इज़ द हेल्थ स्टेटस और उस पर फिर अकॉर्डिंगली स्टेट्स और यूटीज एक्शन ले सकती हैं.
And medical experts at ICMR have said that India has sufficient testing capacity for COVID-19. Currently, the reagents to test over 1 lakh of samples are available in labs across the country.
हमारे यहाँ 5 लाख से ज़्यादा प्रोब्स जो हमने अमेरिका से मंगाए थे वो ऑलरेडी आ चुके हैं. तो इसका मायना हम 5 लाख लोगों की एडिशनल जो 5 लाख लोग रहेंगे उनकी टेस्टिंग कर सकते हैं. अभी भी जो लैब्स में कैपेसिटी है उसमें 1 लाख से ज़्यादा लोगों की टेस्ट करने के रिएजेंट्स अभी भी पड़े हैं. तो इसका मायना हमको टेस्टिंग के बारे में डरना ये ज़रूरी नहीं है. जिस किसी को ज़रूरी पड़ रही है टेस्ट करने की वो कहीं भी आए, सरकारी इसमें अगर उसका सैंपल आया ICMR के नेटवर्क जो लैब का है उसमें तो भी वो टेस्ट होगा. अगर वो प्राइवेट सेक्टर में गया उसके इंडिकेशन सेम रहेंगे, वो प्राइवेट सेक्टर में भी अपने स्वैब की जांच करवा ले सकते हैं.
And Union Health Minister Dr. Harshvardhan inaugurated a tele-consultation facility at AIIMS so that doctors across the country can seek information as well as share expertise related to treating and managing COVID-19 patients.
सारे देश भर के डॉक्टर्स जो इन मरीज़ों का इलाज कर रहे हैं उनका आपस में भी सलाह मशवरा होता रहे और उनका ऑल इंडिया इंस्टीट्यूट ऑफ मेडिकल साइंसेज न्यू दिल्ली के एक्सपर्ट्स के साथ भी लगातार कंसल्टेशन होता रहे. इसके लिए हमने ये कोविड-19 नेशनल टेली कंसल्टेशन सेंटर कॉन्टैक्ट जिसका टेलीफोन नंबर है 9115444155 इस नंबर के माध्यम से, इसकी बहुत सारी लाइनों के माध्यम से सारे देश के कोविड-19 का इलाज करने वाले डॉक्टर्स यहाँ से भी संपर्क में रहेंगे और ऑल इंडिया इंस्टीट्यूट के डॉक्टर्स भी क्रिटिकली इल पेशेंट्स को किस प्रकार से हम बेस्ट पॉसिबल तरीके से, जब ज़्यादा उनको केयर की ज़रूरत है, वेंटिलेटर्स की ज़रूरत है, उनको ऑक्सीजन की ज़रूरत है या और भी ज़्यादा कोई डिटेल्ड केयर की ज़रूरत है, तो आपस में एक दूसरे के साथ सलाह करने का काम होगा.
Moving on, Prime Minister Narendra Modi today interacted with AYUSH sector practitioners via video conferencing. Prime Minister said that AYUSH sector has a long tradition of keeping the nation healthy. He observed AYUSH network is spread through the length and breadth of the country, so it's imperative for them to utilize this network while working according to WHO guidelines to spread the message of good practices that need to be adopted in efforts to control the coronavirus. He also praised the ongoing efforts of AYUSH Ministry in promoting yoga at home to de-stress the mind and strengthen body during this difficult phase. Prime Minister underlined the importance of countering and fact-checking unsubstantiated claims of AYUSH having cure for the disease, adding that AYUSH scientists, ICMR, CSIR and other research organizations must come together for evidence-based research. Prime Minister suggested AYUSH medicine producers should utilize their resources towards producing essential items like sanitizers that are in high demand these days. The AYUSH practitioners lauded Prime Minister for leading the country's fight against COVID-19. This was in the series of PM's interactions with various stakeholders who are playing a crucial role in tackling and containing COVID-19. And Finance Minister Nirmala Sitharaman today made one-to-one calls with CMDs of all public sector banks. During the interaction, she acknowledged the role of public sector banks and encouraged them to keep up their efforts in providing uninterrupted banking services across the country. She also asked CMDs to make sure there was adequate liquidity at the branch, ATM and banking correspondent level as well. She tweeted and said, had a detailed conversation with the chiefs of banks, public and private sector, encouraging to know that they are doing their best even during the lockdown. They are certain that they'll ensure customer service without disruption. Social distancing is being adhered to as well. Now, as per the guidelines of Union Finance Minister Nirmala Sitharaman, Department of Financial Services has created a new Twitter handle, namely @DFSF, cites Corona fights to provide a direct route to customers for their complaints, queries and concerns on banking and insurance related issues with regard to coronavirus related measures. And 481 Indian evacuees from coronavirus hit Italy's Milan and Rome have been put under care at ITBP Chawla quarantine facility in New Delhi. These two batches of 218 and 263 persons reached India from Italy on 15th and 22nd of March. No one in the group has been tested with coronavirus symptoms. All basic facilities, including daily monitoring and regular checkups, are available for the evacuees at the centre. Emergency arrangements have also been made to be catered at the centre, including isolation beds and ambulances. Delhi Chief Minister Arvind Kejriwal has appealed to migrant workers to not leave the national capital in the wake of 21-day lockdown, as Delhi government has made sufficient arrangements for them. He also said the government is providing free meals and shelter to the needy.
प्रधानमंत्री जी ने जो कोरोना को रोकने के लिए पूरे देश में लॉकडाउन का ऐलान किया है, ये बेहद ज़रूरी है। अगर इसको हम लोग पालन नहीं करेंगे तो जैसे दूसरे देशों के अंदर ये महामारी इतनी जानें ले रही है, भगवान ना करे हमारे देश में ऐसी परिस्थिति आए, तो हमें इसको पूरी तरह से पालन करना चाहिए। अगर हम इतनी बड़ी संख्या में शहर छोड़ के जाएंगे तो कोरोना के बहुत तेज़ी से फैलने का खतरा पैदा होता है। जो जहाँ है वहीं रहे। आपको जो भी दिक्कतें आ रही हैं, मैं आपको आश्वासन देता हूं कि आपको किसी तरह की दिक्कत नहीं आने देंगे।
And he added that the government will provide 7.5 kg free ration to the people of Delhi.
आज से 4 लाख लोगों को खाना खिलाने के लिए हमारी कैपेसिटी तैयार हो गई है। आज 568 स्कूलों में खाना खिलाने का इंतजाम शुरू हो गया है। 238 नाइट शेल्टर्स रैन बसेरों में खाना खिलाया जा रहा है। तो लगभग 800 सवा 800 ऐसे सेंटर हैं जहां से खाना खिलाया जा रहा है। प्रति व्यक्ति फ्री दिया जाएगा। इसमें गेहूं और चावल दोनों हैं। तो 7.5 किलो राशन प्रति व्यक्ति फ्री दिया जाएगा 71 लाख लोगों को। आज से 1000 दुकानों में बंटना चालू हो गया। बाकी दुकानों में कल या परसों तक पहुंच जाएगा। उनको भी बंटना बहुत जल्दी चालू हो जाएगा।
In Jammu, 2 hospitals, Psychiatry Hospital and Chest Diseases Hospital, have been exclusively dedicated for treating COVID-19 patients. Additional manpower, if required, in the twin hospitals will be provided by National Health Mission. Beds, ventilators and other necessary equipment required has been put in place, and the 2 hospitals are ready to handle COVID-19 patients at any time if need arises. As part of its efforts in the fight against coronavirus, Jammu and Kashmir Union Territory Government has already dedicated Government Hospital Gandhinagar entirely for treating COVID-19 patients, where 200 isolation beds are being readied, in addition to 90 beds already in place.
The total number of cases in Jammu and Kashmir is 28. The number of active cases is 25, of which 21 are in Kashmir division and 4 are in Jammu division. Our teams have been consistently and aggressively trying to trace out every single contact and test them. This will cause some inconvenience, and this is where we need your support, cooperation and understanding.
And quelling apprehensions about India entering stage 3 of COVID-19 infections, Director General of Private Hospital Association, Dr. Girdhar Gyani said that the country is well prepared to fight with novel coronavirus. All government and private hospitals are coordinating to eliminate the infection. Dr. Gyani clarified that with the help of the lockdown, the virus is still in the second stage and the situation in the country is totally under control.
Some question is being asked, are we in stage 3? So let me clarify very clearly on the scientific basis that the number which is increasing day by day is still arithmetic. It is not geometric or exponential. And that is why we are safely, we can say, we are nowhere in the stage 3 and hopefully we will remain in the stage 2.
Following Supreme Court orders and in light of COVID-19 pandemic, High Part Committee in Uttar Pradesh has recommended the release of on parole of some classes of prisoners. Anand Kumar, DGP Prisons of Uttar Pradesh, said that around 11,000 prisoners will benefit from this.
माननीय उच्चतम न्यायालय के दिशा निर्देश के क्रम में 7 साल या 7 साल से कम के सजा याफ्ता बंदी को पैरोल देने पर सहमति बनी है। साथ ही साथ जो 7 साल या 7 साल से कम के अपराध के कारण जो अंडर ट्रायल बंदी जेलों में हैं, उनको भी इंटरिम बेल देने पर सहमति बनी है। ये माननीय उच्चतम न्यायालय के दिशा निर्देश के क्रम में ये बैठक में ये तय हुआ है, इसको लेखबद्ध किया गया है और फिर माननीय मुख्यमंत्री उत्तर प्रदेश महोदय की सहमति से ये आदेश निर्गत किए गए हैं। कुल मिला के 11,000 बंदी ऐसे हैं सजा याफ्ता और अंडर ट्रायल्स मिला के जो इस पात्रता में आते हैं और जिनको इसका बेनिफिट अतिशीघ्र मिलेगा।
Some updates from across the country. In Tamil Nadu's capital, Chennai, jail authorities took a unique initiative to connect the prisoners to their families as outsider entries have been banned. Given the lockdown, authorities allowed prison inmates to talk to their family members and friends via video conferencing. In Himachal Pradesh also, Shimla Gurudwara Sikh Committee distributed food to the people in need. Meanwhile, in Pune, an NGO picked the responsibility to feed stray animals. The NGO is trying to cover every nook and corner of the city to feed animals in need of help and food. Although the essential services are running efficiently throughout the country, still to discourage people from leaving their homes, bank employees in Chandigarh brought the ATM machines at the doorstep of the citizens. This became possible only with the help of district authorities as well as the bank employees. Meanwhile, RBI governor appealed to all to use digital modes of payment to ease pressure on the banking system.
Dear friends, we are going through very difficult times due to the spread of coronavirus. At this point of time, we should take all precautionary measures. One major way of protecting ourselves from coronavirus would be to use all kinds of digital payments, including debit cards, credit cards, and various mobile apps. Pay digital, stay safe.
Nepal has reported 5th case of COVID-19. A girl who had returned from Belgium via Qatar has been tested positive. According to spokesperson of Ministry of Health and Population, her condition is stable at present. Nepal has conducted 875 tests so far, out of which 870 have come out negative, while 5 persons have tested positive for COVID-19. 4 patients are currently in isolation and 1 has recovered. Meanwhile, Nepal has sent an aircraft for China to collect medical supplies, including personal protective equipment and test kits for treatment of COVID-19. Nepal Airlines plane took off from Kathmandu this afternoon. It was expected to return on Sunday. And Maldives Parliament has become virtual in view of coronavirus outbreak. All the sessions of the Majlis, the Maldivian Parliament, is going to be held online via video conferencing now. A rehearsal of virtual session was done on Saturday, in which Mohammad Nasheed, Speaker of the House, also participated. The official virtual sessions will start from Monday and will continue till the health emergency is lifted. As a gesture to show their gratitude, New Yorkers in the U.S. clapped and cheered for frontline workers fighting coronavirus outbreak. Residents participated in the mass applause as a planned initiative by an international public relations agency. According to Time Out New York, videos uploaded on social media showed residents cheering for the healthcare and essential workers in New York, following hashtag Clap Because We Care. There are more than 100,000 confirmed cases of coronavirus spread throughout the United States, but New York is among the hardest hit with 44,000 cases. The trend is being followed worldwide, including France, Britain and India, with people ringing bells, clapping to show their gratitude and respect for the frontline warriors.